Back in mid-September, our administration announced a temporary ban on the retail and online sale of all vaping-related products because of the increasing reports of lung-related illness and deaths with no known cause. We issued this emergency order after consulting with our leading medical professionals, and the Department of Public Health began collecting more data statewide on vaping-related illnesses and deaths. Since then, the Cannabis Control Commission has taken action to quarantine nearly all THC vaping products. And since September, 278 suspected cases of vaping-related pulmonary injury have been reported to DPH. Tragically, that includes 3 confirmed deaths. The Centers for Disease Control has tracked these cases on a national level, with 2,290 cases of vaping or e-cigarette associated lung injury reported to the CDC, including, tragically again, 47 deaths nationwide. As part of this pause, we called on all levels of government to act, and today we are here to sign a bill authored by our colleagues in the legislature that responds to this crisis. The bill we signed today, goes a long way toward restricting access to the most addictive kinds of nicotine and vaping products. It also provides the Department of Public Health with clear authority to regulate the sale of nicotine vaping products to protect the public health, as the Department continues to work with the CDC and other authorities to address the causes of vaping-related lung injury. Longer term, the bill will keep kids and teenagers from getting their hands on vaping products, especially flavored products that encourage young people to start using. The new law will also make sure electronic cigarettes are treated the same way as traditional tobacco products concerning taxation and point-of-sale restrictions. Both of these issues, preventing youth access and leveling the playing field with regular tobacco products, are hugely important, and I'm thankful that lawmakers included these provisions. Today, our administration will also begin developing new, long-term regulations regarding vaping to be certain that we can respond responsibly and quickly to the information as it develops concerning vaping-related lung injury. In order to accommodate this regulatory process, we are keeping in place the emergency ban on the sale of all vaping products until December 11th. At that time, we expect to put in place new regulations to ensure everyone knows the legitimate health risks that all vaping products pose. We've asked Secretary Sutters and Commissioner Burrell at DPH to start developing those regulations immediately for presentation to the Public Health Council next month. When enacted, these permanent regulations will ensure the risks are known to consumers, will clarify what interventions DPH can take to address clear risks identified by the developing science, and will ensure sellers are not skirting the new law and selling to kids. We'll also lay out an inspection process to ensure compliance across the state in this new market. I want to be extremely clear about this next point. While this new law we signed today is a major step forward in regulating vaping products, the health risks associated with vaping are still real and are still being investigated by the CDC. That's why we're keeping the emergency ban in place until December 11th while we develop these long-term regulations that will implement protections provided and intended in the new law. States like Massachusetts can only do so much to address vaping-related lung illness. The federal government, and specifically the CDC and the FDA, are the entities that can effectively regulate these products on a comprehensive nationwide basis. Unfortunately, it's becoming increasingly clear that the federal government is not going to act decisively, so we're going to do everything that we can with state-level authority that remains to us. Based on the public health risks, it is likely that people will continue to get sick, and that's why we will continue to track these illnesses and do what we can with DPH's regulatory authority, including authority granted under this new law. We remain committed to doing all we can to ensure that we protect the public health, and that's why we're pleased to sign this legislation and begin the process of adopting permanent regulations for these products. I especially want to thank the House and the Senate for all they did to move quickly on this legislation late in the first part of this annual session. And I especially want to thank Senate President Karen Spilka and House Speaker Bob DeLeo and Senator Keenan and Representative Gregoire for their leadership on this issue. I also want to take this opportunity to thank the public health professionals, medical professionals, and others who were always there whenever Commissioner Burrell or Secretary Sutters or Lieutenant Governor Polito or I or anybody else in our administration reached out to them to collect data and information and get guidance on what the best and most appropriate things for us to do here in the Commonwealth would be. And I also want to give a special shout out to the Attorney General and the folks in her office for all the work they did on many of the legal issues that remain that are associated with this issue in the courts.